Good morning, everybody. I'm going to talk this morning about the evaluation that we did in IED last year of social protection. In fact, the evaluation looked at ADB's social protection strategy that was approved by the board in 2001. So that actually makes it a bank policy, and it remains a bank policy. This was the first evaluation of social protection done by IED, so potentially there was a lot to learn because the policy had actually been in place for well over a decade. Let me say something at the start about independent evaluation. This study was independent because it was done by a team of staff who have not been involved in the design of projects. We don't implement projects, and nor were we involved in the design of the policy. So independent evaluation is independent of ADB operations. Now, we do more than just look at the performance of projects. We also look at the performance of programs, policies and strategies. And our evaluations are both backward-looking and forward-looking. They're backward-looking because we want to investigate what did ADB do, how did it respond to the social protection strategy, was it effective in its response, did it deliver results? And then we want to look forward because we want to say something about the future direction of ADB in relation to social protection. Is ADB going down the right road? The evaluation approach was fairly straightforward. We wanted to know how ADB had responded to the social protection strategy. What did its portfolio of social protection interventions look like? We wanted to be able to say something about the relevance of the social protection strategy going forward. I mean, it had already been in place for 10 years, so was it still relevant to the needs of the region? And then we wanted to know something about what had been the impact in Asia and the Pacific, and indeed elsewhere in the world. And then we wanted also to be able to say something about how ADB could be more effective in providing social protection moving forward. So the starting point for the evaluation was the social protection strategy itself. Now, this is really interesting because the strategy advocated the provision of social protection to all citizens of Asia and the Pacific. And it also called for a shift, quite a radical shift in the way ADB works, because it wanted to shift away from crisis support, responding to an emergency or a natural disaster or an economic shock, and move away from that to building social protection systems in non-crisis years, particularly to build the resilience of the poor so that they can deal with future shocks. And this was ambitious because ADB was not providing a great deal of social protection at the time, so it required quite a big shift in the way ADB operated. Now, as well as that, the strategy actually defined quite a broad definition of social protection. In fact, it defined a social protection system. And a system generally involves three things. It involves protection of incomes, it involves the protection of the poor from destitution, and it involves making labour markets work better. So in the first instance, it's about protecting incomes from a shock, and this is generally social insurance. So you can think of pension schemes, you can think of health insurance, maybe unemployment insurance. And these are generally contributory schemes. So all of you in here contribute to your health insurance, which ADB provides. So, if you think about it, you've probably got, everybody in this room has probably got some of the highest levels of social protection anywhere in the world. But these are deferred payments. They're not safety nets. These are payments that happen as you get older and perhaps you're not able to work, or they're payments that are made when you fall ill. And then there's the second point, which is to protect the poor from destitution. This is social assistance, also often called safety nets. These are non-contributory programs, generally funded by the state, that transfer resources to the poor. Finally, making labour markets work better. And this is where people are generally surprised by social protection, because it includes technical and vocational education and training, TVET. and it includes skills development programs, livelihood development programs, and microfinance. And these programs generally kick in, or they're generally designed alongside safety nets, because it enables people to graduate out of social protection and into a job. And a job is actually the best form of social protection that you can have. So was ADB successful in implementing its strategy? The first thing we found is that ADB, in fact, did not shift from crisis to non-crisis support. ADB support is still concentrated in crisis years. So ADB responded quite dramatically to the Asian financial crisis in 1997, and then social protection kind of dwindled away almost immediately after. By 1999, there were no loans for social protection. And then the food and financial crisis kicked in around 2008, 2009, and again, ADB responded. But then by 2011, ADB support for social protection again dropped to close to zero. When you look at social protection over the entire 10-year period, it's actually quite a small amount of ADB support. It's about 2.5%. So you could conclude from that that social protection is not a priority for ADB. This is not a very easy chart to look at, but the point I want to make here is that ADB's support for social protection is scattered over a huge number of different interventions. The social protection strategy identified 33 different types of intervention. When we counted them, there's actually 42 different types of intervention. TVET is actually the most popular, it's the most frequent form of social protection divided by ADB. This is followed by TA for pension reform, and that's largely been provided in India and China. Food aid is still provided. A lot of that kicked in response to the food crisis in 2008. And then quite a substantial amount of support to TA and knowledge creation, where ADB has actually been quite active. But what you can conclude from this is that ADB has not really developed expertise in any particular area of social protection, but that doesn't mean it can't be developed. Now, the region also underinvests in social protection. In fact, investment by Asia and the Pacific is amongst the lowest in the world, comparable with sub-Saharan Africa. And this is an important point because it suggests that the region is still not prepared for a future crisis. And we know that a future crisis will come. People in this region are more likely to be involved in a natural disaster than anywhere else in the world, more than Africa, more than North America. The other point, though, is that the region is not prepared for other shocks, perhaps more idiosyncratic shocks such as aging. And you could also argue that the region is not prepared for youth bulges. You could argue that the region does not have a comprehensive program to deal with malnutrition. And you could also link this to performance by the region against the MDGs, where performance, particularly against some of the human capital targets, has not been particularly strong. Now, this is not to say that Asia does not invest in safety nets. All governments spend some money on safety nets. All governments spend some money on helping the poor in some way, and have been doing since Roman and Egyptian times. And this, the issue is how to do this effectively and efficiently so you actually reach the people who need it the most. What tends to happen in the region is that broad-based subsidies, commodity subsidies, are favoured. These are not necessarily effective safety nets because they're broad-based, so they tend to be captured by the better off. So they don't necessarily benefit the poor. And they're expensive. And because they benefit the middle class, and because the middle class have got a lot of political clout, they're very difficult to unwind. And there's experience throughout the region, in Indonesia, for example, that spends more on fuel subsidies than it does on healthcare. Bangladesh has broad-based subsidies on fuel, fertilizer, and food. Again, very difficult to unwind. Now, elsewhere in the world, countries have shifted away from broad-based commodity subsidies to cash transfers. And this is where most of the evidence on social protection, and on safety nets in particular, come from. So there's compelling evidence on conditional cash transfers from Latin America, particularly from Mexico and Brazil, where conditional cash transfers were started in 1995. These programs have been rigorously evaluated and are more researched than any other type of development intervention, period. As a result, there's a huge body of evidence that suggests that these programs, when well designed and well targeted, reduce poverty, have an impact on human capital, and can also reduce inequality. Now, the evidence base in the region, in Asia and the Pacific, is actually much more thin. When we were doing this evaluation, we didn't have a lot to go on. However, there is evidence emerging, particularly here in the Philippines. I think most of you will be familiar with the Patuwind Pamilya program, the conditional cash transfer here, that was started in 2008 by the government with support from the World Bank and AusAid. The program was then rapidly scaled up in the face of the food, fuel and financial crisis, and support from ADB kicked in 2010. This program now reaches 3 million families, 3 million households, which includes 6 million children. And it's aimed at improving the health and education of children, but particularly the health of pregnant women. That's also targeted in this program. Impact evaluation was built in right at the early stages. So of the 1,418 families who all qualified for the program, so who were all identified as equally poor, only half of them got the program and half of them didn't get the program. And the impact on those that got the program was evaluated after 2.5 years. And the results are promising, and in some cases better than results that were seen in countries in Latin America. So I'm going to show you some of the results, not all of them. The program is designed to have an impact on education, and as you can see from this slide, more beneficiary households, the children in those beneficiary households, are attending school at all levels of the education system. What you can't see here is they're also staying in school. This is after 2.5 years of implementation, so these are short-term results. The conditional cash transfer in the Philippines has also had an impact on health, particularly the attendance by households with children at health centres. What you can't see here, and what's perhaps most remarkable about the programme here, is that there's evidence that it's had an early impact on stunting. And this is really important because it's having an impact on very young children. And stunting also relates to pregnant women before children are born, because if pregnant women are undernourished, then they're likely to give birth to low-weight children. And this can also have then an impact on stunting. And there's evidence that stunting leads to low cognitive development and actually affects lifelong earnings. So children who suffer malnourishment, that's likely to affect their income for the rest of their lives and keep them poor. And this is what perpetuates the cycle of poverty. There's evidence in the Philippines that families are actually spending money on more nutritious food. And we interviewed children in Cebu who benefit the program, and they said that they were occasionally eating chicken. Now, contrary to popular thinking, safety nets are not necessarily expensive. Where they've been implemented well throughout Latin America, they cost much less than 1% of GDP. Broad-based subsidies tend to cost more. In the Philippines as well, the conditional cash transfer costs around 0.4% of GDP. I don't know if you saw Santiago Levi when he came into the ADB, formerly the Director of Budget in the Ministry of Finance in Mexico. He argued, who would not want to spend less than 1% of GDP on safety nets, knowing that it's going to benefit millions of people? So, looking forward, should ADB support the development of safety nets? Big question. The immediate answer is, well, yes, of course, because it's a pillar to achieve inclusive growth, which is central to Strategy 2020. And there's a policy that still exists, and there's overwhelming evidence that safety nets have an impact on poor people. But given limited capacity in the ADB, what's the best way forward? We argued that the best way to grow the social protection portfolio is through partnership with other development agencies. This has been the case in the Philippines. ADB has worked in partnership with the World Bank and AusAid and UNICEF, I believe. And there's now work in Pakistan to develop the Benazir Bhutto program in partnership with World Bank and DFID. And this is the way forward. And the World Bank have been in to seek partnerships with ADB to support social protection and the development of safety nets throughout the region. The other way to build social protection and safety nets is by linking it to ADB's core areas of investment. ADB already does that in some programs. In Bangladesh, ADB funds a stipend to keep girls in school and get girls into school. But there's evidence now that it should also be used to get poor boys into school, because actually the opportunity cost for boys is higher than girls because they can earn more when they're out of school. So these programs need to be extended to cover all poor children. Social protection has also been used in road maintenance programs in Bangladesh, where poor women have been employed to maintain roads. And these programs have been highly effective. There's also a case for building social protection into energy programs, water programs, and in the financial sector through microfinance. ADB also needs to invest more in impact evaluation, rigorous impact evaluation of social protection programs. It's the impact evaluation evidence base that's convinced politicians throughout the world that they should invest more in safety nets. And impact evaluation has actually played a really prominent part in convincing economists, not just in the World Bank, but throughout the world, that social protection is not a cost that should be minimized, but actually an investment that promotes human capital, and therefore the benefits should be maximized. Social protection is no longer seen as a transfer from highly productive people to unproductive people, but as an investment in human capital. ADB also needs to maintain its dialogue on social protection long after a crisis is over. During a crisis, there's all this intense activity to pump money into economies that are suffering from a crisis, and then the dialogue ends. And the dialogue could be sustained through dialogue on inclusive growth, and that's the key to keeping it going. And that's obviously happening at the moment in the Ministry of Finance in Pakistan. And it's the Ministry of Finance that need to be convinced. Finally, ADB needs to maintain its research on social protection. Sri Handiani in RSDD has played a very leading role in research in ADB, and the Social Protection Index is a good example of the kind of research that ADB is capable of producing. And that's it. Thank you very much.